This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your special host, the General Manager of Keating Dental Arts, Bob Brandon.
Hey everyone, Bob Brandon here, and welcome to another episode of the Dental Up Podcast. Our guest this week earned his DMD degree from Southern Illinois University and completed an MBA at Brandman University in International Business in 2016. He's a seasoned educator in clinical topics such as head and neck anatomy, biophysics, surgical extractions, and oral implantology. Currently practicing in Palm Desert, California, please help me welcome to the show today, Dr. Kianor Shah. How's it going, Dr. Shah?
Thank you for having me on the show, Bob.
Thank you. Well, I know you're a busy man and you have a full day of patients today, so let's get right down to it. I want to begin by asking you how you first became interested in dentistry, and at what point in your life did you think, okay, I want to be a dentist?
Back in undergraduate, I was studying to become a cardiac surgeon, but I volunteered in the local hospital, where I accrued some community service hours, and saw how the cardiac surgeons were operating and coming in late at night, and also having the interactions with the patients, things of that sort. They were telling stories about hardship at home with their families. It was just not for me. I'm not saying every cardiac surgeon has these problems, but I wanted to help people, but at the same time I wanted to be able to set my own hours to attend to the patients on my schedule. And one thing led to another, and one of my best friends got accepted into dental school, and I decided to go the dental route.
Excellent. And that's what I enjoy most about my job here is getting to interact with our customers and our dentists, and hearing the story about their families and how their kids are growing up, and I truly believe in even my own personal experience with my father, who's a dentist. Having him around and having him be able to participate in my life and my siblings' life has been just so beneficial. And you're still able to help a tremendous amount of people at the end of the day. So thank you.
Yeah,
for
you
that.
have to be good at multiple things. When you're a professional, in our industry, we're not really regulated like the hospital doctors are, and you have to be multitask. It's just not enough to be good at one thing, even in your clinical practice. So diversification is very important. You have to be good at home. You have to have time to spend with your family. You have to be able, all those things sum up to a happy life.
Absolutely. And you epitomize that truly in all of your many talents. And we'll get to that as we get through this podcast. But I was on your website last night. I must admit I was cheating a little bit, but I was so impressed with how many different facets and areas of dentistry you have become not only proficient in, but mastered, and you've attained fellowship status in so many different organizations. Why don't you tell me a little bit about your dental school experience, and then how those experiences sort of guided and shaped you into the dentist that you have become today?
So dental school is the basics, the 101. When we went to school, I was very interested in surgery about third year of dental school. Towards the end, I almost had all my requirements done. And I would go in a lot into the oral surgery department and clock in. And we had a really nice doctor there that taught me a lot. But still, when I got out of dental school, I was sitting there reading off probing numbers, and it was all too new to me. And the doctor walked up to me. He's like, "You're not the doctor I associated with." He's like, "You're not in dental school anymore." When I was doing the endo, I would be very, very conservative in opening up an access. And, same thing. He would come over and say, "Hey, if you want to really work in that tooth, you got to open it up more." So when you get into the learnings of dental school, they didn't teach us anything about business, and they don't in many of the dental schools. And you have to get out and get your feet wet. So with everything rapidly changing in dentistry, every 5-10 years, there's so many new technologies, procedures are changing. You walk through laboratories, they don't have burnout ovens anymore. They have scanners and printers, and so the dental schools can't keep up. So you're only going to get your basics in dental school, and certainly business acumen is or business training of any kind is not really taught at the dental schools. So dental school experience was good, but I did one smart move when I got out is I found a senior colleague to take me under his wing, and eventually he wanted to sell his practice and I wanted to buy. So I didn't go the corporate route, and I started learning from that doctor, and another doctor came around a couple of times a week, and he would do everything, the root canals, the implants, the sinus lifts, and just hanging around him, I probably learned more from him in the year and a half that he was with me than I did in dental school. Southern Illinois University School of Dental Medicine is a small school down on the border of Missouri in Alton, and I spent some time there. And it was a very good experience. We had a lot of interactions with the faculty. The smaller the school it is, it tends to happen that way. But certainly not enough to be able to go out and know it all at that time.
Yeah, it provides a basis. And I think you've touched on another theme of many of our customers where, after they graduate dental school and then it's like, what's next? Well, you hit the perfect scenario by joining up with an older experienced dentist that was looking for an exit strategy and was a multitasker and did everything. And was this first practice after dental school, was it in a smaller town? Were there other specialists available, or was this more was the practice, the do everything practice, more out of necessity?
There were. It was a very small town of 14,000 people, and I believe you had 7 dentists in town.
Oh wow!
That was probably the most lucrative environment I was in. So in my opinion, small town America, you can do very, very well in if that's where you want to settle. For us, there was probably a 60-mile radius where we didn't have an oral surgeon. We had an endodontist about 30 miles away, but you had to drive all the way to the Fairview Heights area from where I was. So patients don't like to travel that far. So you have 2 options. You can be you can start learning those tasks and taking continuing education and doing them yourself, or you're gonna have to inconvenience your patients to go to get that kind of treatment done. So I was working with there was also a periodontist in town where the endodontist was, and I was working with those guys at first, but then I started doing more endo myself, and I got the skills I picked up in dental school allowed me to do the thirds myself. The other doctor that used to come in, he was doing some orthodontics and Invisalign, and one thing led to another where I started just about doing everything myself. That's
great. Is there one area that you particularly enjoy more? And I know you've touched on surgery a couple times. Is that still a focus, or have you maintained everything equally at your current practice?
I like surgery, and in 2006 I got out. In 2007, there was a company by the name of Camlog out of Germany. They had a weekend course up in Chicago.
We know them
pertaining implant placement. Mm-hmm. So they invited us. They said, "Hey, this is a course so you can get the basics a little bit and introduction." And I love doing extractions. Always have. And so I'm like, okay, let's go up there and see what they're talking about. And that weekend course led to a career now of 13 years of placing implants and doing sinus lifts and all kinds of all on 4s and all on 8s, where after a while, there's only so many MODs you're going to do where you don't get excited about it anymore, or so many denture adjustments. If you're not improving yourself, you're dying. And that's basically the philosophy I took. If you're not innovating and you're improving yourself, you're essentially slowly or quickly dying.
Definitely. So when you came out to California, how long did it take you to establish your own practice?
First thing thing I had to do is up my dental skills. So I mean, not dental skills, but also qualifications. So more fellowships, and then the mastership and diplomate. But I saw an arbitrage opportunity. The market saturated every corner in LA, another dentist. And these guys weren't skilled or qualified always to do their own endo. They were referring it out. They were sending their extractions out, and they were sending their implants out. So I started advertising in the Dental Trader and other venues like Dental Shopper. Started saying, hey, I'll come to your office. I'll bring my own equipment. I still had some equipment from Illinois, my implant motor and all of that, my extraction instruments. And I started going from office to office, and I got so busy. I go in, we do an implant, we split the fees essentially equally after overhead, and started doing endo, implants, and oral surgery in all of these offices for a few years, while I was doing the fellowships and while I was doing the MBA. And there's a particular reason I did that MBA, and there's a particular reason I started setting up the International Extraction Academy and the Global Summit, is because I wanted to see if I can create a bridge for younger doctors like that are coming out of school and are in the same situations to get more excited about surgery and be able to go through this bridge of first extractions and then the easy implants and the more complex procedures. But for the longest time, I was essentially traveling. I believe over 300 offices I've done something in, surgery of some kind.
Wow.
Or full mouth restoration or what have you. But for the longest time, I was just traveling all over San Diego, North LA, Inland Empire, and it was quite lucrative. It was certainly better than $500 a day.
Yeah.
And eventually we got an associate situation here in Palm Springs, and then I set up my practice in Palm Desert in October of 2017.
And do you have associates that work for you while you're out in all your teaching endeavors?
No, I am doing something very unique in Palm Desert. It's when I had all those 6 offices, the most challenging thing wasn't the dentistry. It was all of the employees and the benefits and the vacations and the raises, and the HR was what was making me old and lose my hair. So I decided it's best to just have a small operation, 2 chairs, very, very high class. So I came in, I picked up about 1,000 square feet on El Paseo, which is like a road like Rodeo Drive, but out here in the desert. And I'm the only dentist on the strip, and it's a different situation. There's 2 chairs. I see 8 to 10 patients maximum a day. Give them full attention, and I spend time with them. I'm not running from room to room, numbing people, having some office manager telling me, go in this room, do crowns, go in here and do fillings, and all that stuff is gone from me.
Very smart.
I'll never be interested in that again. But then these patients become friends. If you, for example, go online and look at our reviews, just one after another, they bring us things, and we do fun events with them. You just sit down with them for half an hour, 45 minutes at the initial appointment. Just listen to what they want. Just because they told you to do it a certain way in dental school doesn't mean this is what your patient wants. You might actually upset the patient if you're trying to do what the status quo is. So just listen to what the patient really wants, and then put yourself in their shoe and see how you wish to be, how you would like to be treated. So it's a completely different environment. We do bigger cases. Like, for example, this morning I went in at 8 and I did bilateral sinus lifts, put in 4 implants, did 6 fillings, did scaling root planes on this patient that was under sedation, and he's happy as can be that he just left, and I came here to get on the show. But work smarter, work better, and do it with quality care, and everything falls into place for you.
Absolutely.
Even out of 2 chairs, and I'm making more money out of 2 chairs than I was in a same day scenario in the other practices.
Yeah.
Outside of my first practice, that was very lucrative.
Yeah, you touched on a number of important points there on listening to your patients and providing a higher level of care. And I think a lot of our clients, and probably a lot of dentists in general in the United States and around the world, they feel so rushed to produce and to hit a number because they've got the overhead, they've got the staff, wages and everything to meet. But I applaud you for taking the opposite stance and really putting the patient first and allowing that patient to, really benefit from your skills and your additional training. And, it sounds like it sounds like you've got a great life because of that too. I mean, it's.
But Bob, you got to look at the facts of the matter. The golden age of dentistry is over. The corporations have come in. They're profit driven, no matter what they say.
Yeah.
They're profit driven, and no matter how they structure their systems, at the end of the day, they want to see numbers. There's somebody sitting in some management company that's running the show that wants to see numbers. In that environment, you end up with dentists in the marketplace that are 65 that can't pay their student loans, that are still working. But there's also an arbitrage opportunity. You can do something they can't, which means if you just focus your time and effort on one practice, get involved with the community, get involved with the chamber, start marketing, do quality care. And, I don't care about all of the different venues of marketing dollars out there and what works and what doesn't work versus print and social media, all that nonsense. Most powerful remains the word of mouth.
Absolutely.
And you can beat the corporations and you can compete with them and you can do better than them. But you have to carve out in environments where these type of transitions happen. When corporations come in and take over, there is also an opportunity for the individual doctors to flourish if they do it properly.
Yeah, and that's been our philosophy of this business of Keating Dental Arts. We've undertaken that from the onset, where we put the customer and the patient first. Our motto is creating smiles every day. I mean, we don't want to be the biggest, Sean might kill me for that, but, we want to be the best. And, we really take a lot of the same philosophies that I believe you have in your practice into, treating our 750 customers across the U.S. on a monthly basis. And yeah, I do know that corporate structure. We have a very large California entity that's located less than a mile from here. And, sometimes I'm on Red Hill Avenue and I drive by their nice, shiny, huge building. And I was like, well, there's a lot of bean counters and accountants and MBA types in there that are making a lot of money. But I often wonder, how, what kind of dentistry is being done there. So anyway, enough of that.
Dentistry is not, I've been in those environments and I've learned a lot on how they operate. And dentistry is just not a standardization, cookie cutter, customize everything, put a bunch of robots in there, and it's not sustainable. But they will find that out in the long run.
So being at the forefront, on the educational side and by providing so much continuing education, I want to ask you a little bit about, technology and some of these, newer, devices and pieces of equipment. What's the latest that's in your practice? What do you find, your one or two new purchases, this can even go back 2 or 3 years, but some pieces of equipment or some technologies that you just can't live without?
Certainly can live without my CT now. We just purchased a very nice imaging system. And you got to protect yourself and you got to protect your patients. If you're even doing, wisdom teeth, or if you're doing implants, you really want to be able to image better. And it establishes a great patient rapport. When patients see me manipulate the slides on a CT scan and place an implant in there and explain to them where they have little bone, where they might need additional bone, where the sinus is, where the inferior alveolar nerve is, and all of the other anatomical landmarks, and just talking through with them as I am studying the CT, pretty much sells the treatment plan. So I picked up a PAX i3D Green from Vatek, and software that I'm working with is very easy to use, the Easy 3DI. And we have digital X-rays in the office. We're just starting to work with a scanner, which I can't discuss that much because it's getting ready to go public for this company. But I act as a key opinion leader for this entity, and the world is changing. I'm thinking myself, if I don't use any more impression material, I don't have to buy anymore, and this is going to be cleaner, and I can go ahead and pick up the STL file on the scanner, email it over to a lab that accepts it, like yourself, and have it turn around in the mail. One way mail is only necessary. I'm not a big CEREC guy because patients come in with the CEREC. Either you have to send them out, or they're going to be sitting there in your office bored for 4 or 5 hours. By the time everything is baked, cooked, done, it's just not efficient. I believe it's my opinion. But being able to take the scan, mail it over to the lab, have the lab mail it out and send it to you. That seems like a pretty good ordeal, not only from the logistics perspective and cost, but also patients don't like they always talk about this goo thing,
Yep.
and they don't want the goo in their mouth. And we have advanced. So, digitalization of the practice is going to save you a lot of money and time and create tremendous convenience. You're always going to have the people that are still using flip phones that are probably developing X-rays out there. And
you're right.
And these people are hard to change.
Yeah.
So the newer generations shouldn't even consider it as a plausible option. Although you can probably find very cheap equipment to get started. So digitalization has been my favorite of the last couple of years. I can't keep up with the printers that are coming on with with a different material, but there's a lot of technologies happening. Every conference that I go to annually, the next year, there's so many new people there with new things. It's just mind-boggling at the speed that we are developing.
It is the manufacturers, the vendors, the technology, what's available to us as a dental laboratory and to you as a clinician we're in a very explosive growth phase in the industry. It's very exciting. As we wrap up here, I have one more question, and then I want to give you some time to talk about your upcoming course that's going to be out here in Orange County in about a month and a half. So the last question I'd like to ask is, because you've been out of school, about 15 years and transitioned through so many different, areas of the country and phases of practice. What if you could give some advice to some dental school graduates that have maybe graduated in the last week or in this coming few weeks? What type of advice would you give them?
If they want to be their own boss and they want to set their own schedule and live a very comfortable life, the best recommendation I can make is up your business skill. Start looking for a senior colleague. Transition in with them that wants to get out. Transition into them. Try to pick up as much as you can and make it your own and develop your practice based on your own. You don't have to work hard. You have to work smart. You don't have to own 10 offices to succeed in dentistry. You can get the same results by just focusing on one. That's a mistake probably I made, that I should have just focused on one and stayed with one rather than trying to essentially take over the world, because a lot of dentists are running around buying up practices and doing that whole spiel. You can do just fine out of one practice, 4 days a week, paying attention to your patients. But you got to get into learning. You got to get up your business acumen. Patients don't care about 6-degree tapers. I mean, yeah, we do as clinicians, but they want to come into a clean office. They want to be smiled at. They don't want you to hurt them. They have a whole set of different priorities. And if you once in a while put your hand on their shoulder, that goes a far, far way. So your personal skills. Also work on your personal skills, because they can see, hear, and hear everything that goes on in an office. But the winner is going to be the doctor that works for him or herself.
Yeah, I know, patients, and I've been in a couple offices, and people want to be treated like people. They don't want to be treated like as a number, coming through, standing in line, waiting in the waiting room a long time, waiting, to be seen by the doctor. They want to be treated like people. And now I want to give you the opportunity to tell our audience about this very exciting course you have here next month in July in Lake Forest. Can you please share with us about your course? And I look forward to seeing you out there.
So, in addition to the International Extraction Academy, where we're holding 5 workshops this year, and also have an online component that has over 30 CE units that you can take at the convenience of your home, which ranges from topics of anatomy all the way to complex implantology and everything in between, from pharmacology to anesthesia to different techniques in surgery and pathology and the endodontic perspective, and on it goes. Those were recorded at the Global Implantology Summit 2018 by the speakers that we brought in from some 40 countries. Wow. and that are specific expert in that particular field. So that was pulled out of the classroom, so doctors can watch that at home and gain a lot of insight and learn from, again, senior colleagues. And after that, they would be able to apply those didactic and clinical information in their practice, but also a hands-on workshop would aid in getting in there on the pig jaws, doing flaps, placing bone, suturing techniques, essentially the guided bone regeneration membranes, and a little bit of lectures at those workshops that happened with Dr. Thomas Wiedemann from New York University. He's in the oral surgery and implantology department there. So him and I have been doing this for several years. Before him, Dr. Hakimian was with us, and Dr. Greenwood, when we originally started recording a couple of courses, a couple of the sessions, and doing some workshops. But it has flourished into something nice where we do it now every year in different areas of the country. So the next one coming up in Charlotte in 2 weeks. You can also look at the extacademy.com. So once you get the Extraction Academy sort of mastered, we have the Global Implantology Institute, where we like to take you to the next step with the different courses that are up there between Dr. Javid, myself, and other doctors that are posting their courses there. But particularly stem cells in dentistry. So about a year ago, I ran into a company out of Orange County by the name of Vidrx. Basically explains what it means. It's prescription done in vitro in the lab. So one thing led to another. I was interested to see what they were talking about, stem cells and neuropathic pain and all of these different procedures that were being used in the medical environment, anti-aging. And I thought to myself, I wonder if there's going to be any benefit to stem cells in dentistry. And the stem cells they were taking were from the cord blood and amniotic fluid and the Wharton's jelly. Cord blood is essentially the cord of the mom to the child during the birthing process. And the cord blood, also known as the cord of life, secretes tremendous amount of stem cells, particularly mesenchymal stem cells that turn into tissues. And also you can find hemopoietic stem cells that turn into blood phenotypes. And understanding that amniotic fluid has over 100 growth factors, that doesn't include all the coenzymes and lutokines and all of the different all of the different factors in it. I kind of figured, there's got to be a lot of medical applications and also some dental applications. So started investigating, and there was a doctor in Irvine that was putting this in for just about all sorts of treatments, from TMJ problems. It was resolving endodontic problems, and on it goes. So I started experimenting with it about a year ago, had some tremendous results for a bone grafting procedure. I had a patient that was numb We recovered about 75% with these cord blood stem cell injections. And then I started a case on osteomyelitis, where we started resolving sinus tracts that the oral surgeons weren't able to resolve for some 2 years, and so I couldn't do implants on this patient. And one thing led another. I got really dived deep into it to see what the story was, and started doing more and more of these cases, and kind of mastered the injection technique and created a protocol for it. And more dentists came around and asked a lot of questions. And so we decided it's time to bring or help pioneer the stem cell industry into dentistry where it's applicable. Now, there's a lot of things to consider when you're working with stem cells. You have to do very thorough consent. You have to know the health history. You have to spend a lot of time with the patient, understanding what their problems are. And the market had a bad taste from some bad players in the space who were trying to line their pockets with easy procedures and profiteering at the expense of desperate patients. But I didn't ask this question. I didn't ask myself if stem cells really worked. The question that I asked myself was, what if these stem cells work and we're not offering it to our patients? What if it could help patients, especially those that have exhausted just about everything else that is at their option, the status quo, patients with chronic pain. So if there was going to be a possibility to help those patients improve their quality of life, and as a doctor, I felt obligated to investigate it. And if indeed my clinical judgment told me that this is real and the possibility existed, yeah, sign me up for it. So you have to understand that where there are indications, you have to understand what those indications are. You have to completely understand what is in this stuff, and amniotic fluid and cord blood cells and Wharton's jelly is the kind of a jelly material, viscous material in the cord blood, in the cord itself. So once you get a good grip of that, you'd be surprised what you find. You're talking amniotic fluid, which is very reasonable to purchase, that you can do with a simple injection. And besides the 100 growth factors I told you about, there's probably 150 plus other cofactors and cytokines and polypeptides and exosomes, and on it goes, that we can't get anywhere else. You can't get it from yourself. When we do PRP and PRF and those type of things, we're lucky if you're looking at 10 important growth factors. So I invite my colleagues to look into this. We decided to implement courses into the Global Implantology Institute, Global Implantology Institute, because it's implantation. It's an implantation of stem cells. And where we're going to get on some of the techniques on how to inject them, where to inject them, what the indications are, what the contraindications are, what the proper flow from the time this thing is manufactured at the extraction facility all the way to the time it arrives at your office in the morning and injected into the patient, what needs to happen to be compliant with the rules and laws and the regulations and informed consent and protocols and then et cetera, and documentation. So we put together some workshops. Workshops are always good. People come out, we spend a lot of time with our colleagues, have a good time, and all learn from each other. So the the first one is in July 20th, and then the next one is on October 19th. We have a limited per 15 students we can do per workshop, and this will be done at the extraction facility and by this FDA registered company in Lake Forest, which is out in the outskirts of Irvine.
Yeah. Oh, that's fantastic. That is a lot of knowledge in a very short period of time. I'm going to make sure that we get this posted all on our website. So when any of our listeners can go, to our website and they can get linked to your Exacta Academy and the Global Implant Institute so that they can learn more about your courses. Again, Dr. Shah, I can't thank you enough for spending the afternoon with us, taking time out of your busy practice and your schedule to really educate our listeners. And it's really been a pleasure speaking with you this past half hour, and I look forward to seeing you again soon.
Thank you for what you guys do for our community and spreading knowledge and information. And thank you for having me on the show. It was great fun.
Great. Thank you so much, Dr. Shah. All the best to you. Take care.
Have a great day. Bye.
Thank you. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.